very socially engaged. But then, as I was starting to work, it was as almost if there was another individual hiding inside him, and that conversation went something like this. Okay, we're ready to work now. If you have a problem, just raise your left hand and I'll stop. I don't want to. Oh, what are you doing now? Oh, get away. Oh. Now, this wasn't verbally communicated, but it was as if his body communicated. This is almost as if the subjective has a voice. So having this insight gave me a little bit of power so that I can move forward. Now, I know that dentistry isn't alone. You know, the physicians, they got their poking and their prodding. Even the chiropractors, they have their head cracking thing. But I think that there's something baked into the cake. There's something intrinsic to teeth and our relationship with them that I think is key to helping us all as people become better patients. Putting aside insurance and benefits and how much it's all going to cost. We really need to step aside and see what we can do to help people if they're in a better place to make decisions and have an open relationship with dentists. Then they'll be able to talk openly and really get their needs met and not do unnecessary care. So really this brings me to the patient of the evening. Her name is Marta, and Marta is a great lady, and she's taught me a lot. I've only seen her 3 times, but her experience, at least for me, really helped me to see deeper into these questions that I was asking for myself. So Marta, she is married to a gentleman who I've been seeing in the practice for a long time. And at her first visit, she saw the hygienist. We cleaned her teeth and did an initial exam. My hygienist, it was like a party, you know. The patient I'd known, the gentleman I'd known from when he was a kid, talking about the wedding, showed the wedding pictures, and talked about the honeymoon. It was a great social experience. And Marta, when she sat in the chair, she was very engaged and happy to share her experience. And when I came in, very similarly, there was a great connection. But there was an issue or something, there was a shift, there was a transition that occurred that made me a little bit aware, a little bit defensive actually. And that was, she had 2 problems. She had a cavity on the lower right, and she had a tooth on the lower left that was a root canal that was failing. So I was talking about what the issues were and what are the different options. And she just shut down. She didn't really say much. I mean, she nodded to do her best to be socially engaged, but there wasn't a lot of interaction. I knew I had to do the filling, so I didn't really pay too much mind. So we brought her in the second time, and we started to do the filling. And sometimes this happens where I get the patient numb, and they're expressing and experiencing numbness, but they're not feeling numb. It's like everything else is numb but the tooth. So there are some patients where I can use the cold laser either on their tooth or on their on the palate. I paint the top of the head, and without saying any reassuring voices, without giving any more Novocaine, they just get numb. Or if they're nervous, do the same thing, they just quiet down. How could light do that? Well, you know, it's the traditional experiences that I've had that have been great, but it's the non-traditional ones that I think are more memorable. So just to take a little bit of a leave from Marta for the time being, I was using this laser. We were extracting a gentleman's tooth. He had an eye tooth up here that was in need of care, and he needed to have it out. He agreed upon it. So it was brittle. It was long. These are very long teeth, and gosh, I didn't want to break the roots. So as I've been taught, to honor the body, to rotate the tooth, and you leave it alone. You come back 10 minutes. There's an enzyme that actually helps to break down the connection to the tooth. So I came back, and sure enough, it was a bit more loose, but as Mother Nature has it, it likes being in the body. So I don't know, something told me to pick up the laser. So as I had my forceps on the tooth, my assistant touched the forceps, and all of a sudden, the tooth came out. Wow, that was pretty amazing. I've had an even more amazing experience using holographic laser therapy. And what I found is that as I'm trying to coax the patient from this subjective to the objective state, invariably there's some type of hurdle. And I use muscle testing, and when I muscle test the case, I find that it helps break through barriers a lot easier and faster. So getting back to Marta, so on her second visit, she was feeling a little anxious and she was having difficulty getting numb, so we lasered it. Because of her profession, she was a massage therapist, she actually is interested in what I was doing, so I was explaining it along the way, so she had a great interest. So we got through the filling, and that was great, but we had to talk about this tooth on the lower left that wasn't serving her well at all. So, you know, gosh, she made such a huge transformation from the first visit to the second, and she was able to kind of communicate, ask some questions, but she was very hesitant, almost timid. And somehow we just got to the point where we were going to get together and extract the tooth. So on that third visit, that's for me when the real big transformation occurred. Now, I explained the way she was on the first two visits. On the third visit, she almost came bouncing in. She was just so, what I was perceiving as so ready to move on. She almost had this catharsis, which really actually was the end result of it all. So most dentists, when they're talking, you know, if they're doing a cosmetic case, they'll have their PowerPoint presentation and they'll show you all their best cases, all the best patients to work with. And I think Marta is a great patient. She's a great lady, but this may not necessarily be one to put on the refrigerator because it was painful for Marta. You know, we were able to help get her numb to a certain degree, but as is the case many times, when a tooth is really infected, everything will be numb but that tooth. We gave her more Novocaine. I was using all the tricks up my sleeve, but she just wasn't able to get there. I don't like to hurt people, so I said, Marta, maybe we should reschedule this. No, 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 she says, I want to do this because it's time to get this out. So we kind of worked through this process, and lo and behold, the tooth came out, but it wasn't fun for her. So as we were wrapping things up, she was happy to get it out, and she seemed like a happy customer. But I needed some reassurance, and I felt that there were some loose ends that needed to be factored into it. I said, is there anything that happened today, anything that's in your mind that you think might have contributed to what happened today? And she said, well, a family member had died, and a distant relative had passed away. I was sad, but that was it. Anything else? Well, she said, when this tooth was done about 15 years ago, I was in the dentist chair when my grandmother died.